Phase 3 of lab to market journey of a point of care test is transformation of laboratory prototype into a marketable product. In this phase also, there are several aspects to be considered while developing the product prototype. The design and manufacturing process adopted for developing the laboratory prototype may not be suitable for upscaling and mass manufacturing. Therefore, the design should be modified as per the mass manufacturing of the final product prototype. The overall design of the test should be focused on developing off the shelf strip or sensor making by considering the storage limitation as well as better stability at room temperature. There may not have sufficient storage capacity in resource limited settings. Another important design consideration is to make sure minimum user intervention of the test process as well as readout device handling. Ideally, it should have single step of sample addition so that all the other intermediate process steps are performed automatically, including result display. The prototype should be tested extensively before going for clinical trials and regulatory approval. The result of the test should be robust enough with repeatability and accuracy. The go-to-market strategy should be robust, including pricing, marketing, promotion, etc. The supply chain network and distribution should be planned properly based on the targeted market and the landscape of final implementation. In this discussion, only technical aspect has been shared, while a point of care test is developing from laboratory to its journey to the market. Other aspects such as fundraising, business development are not included here in this discussion. Thank you.